Hi everyone, welcome back to another episode of Ask Dr. Nick. My name is Dr. Nick Schmidlkoffer and I work for the Neurologic Wellness Institute. And today's question of the day is, can Alzheimer's disease be reversed? And I think this is a really important question because Alzheimer's disease is now the third leading cause of death, as we'll see. And it is something that most people are aware about and that most people maybe are afraid about, or they know somebody that, whether it's close to them or a distant relative, that is or is becoming cognitive decline. And many younger people are afraid that they will end up becoming that. And they don't want to maybe forget their family members. They don't want to forget who that they are themselves. And so a lot of people are a little bit weary about aging, and they want to age well and with their mind and with their ability to think and act for themselves. And so I want to talk about a specific protocol called the ReCODE protocol by Dr. Bredesen. He wrote a book called The End of Alzheimer's. And he basically talks about that Alzheimer's disease or cognitive decline and dementia need a specific protocol. They need a specific for an individual, because the disease is not one single thing, it is multifactorial. And there are many things that can cause it. And so we're going to discuss a paper written by Dr. Bredesen and multiple of his colleagues doing this ReCODE protocol. So let's go right into it. Okay, so here it is, the reversal of cognitive decline in 100 patients, written by Dr. Bredesen and multiple other of his colleagues that are all doing a very similar protocol that is individually based for each patient. It's written in the journal Alzheimer's Disease and Parkinsonism in 2018 was the publishing date. So let's go down. We'll start with the abstract first. And that basically they're saying here that he published the first couple publications that had 19 patients, showing that in Alzheimer's disease or pre-Alzheimer's, like mild cognitive impairment and subjective cognitive impairment, they showed sustained subjective and objective improvements in cognition using comprehensive precision approach medicine that involves determining the potential contributors to the cognitive decline. And we'll get through these potential contributors here in a sec. But it may not be one specific cause, it may be multiple causes or just contributing factors. They used a computer-based algorithm to determine the subtype that patient is in. And they use personalized targeted multifactorial approach called the ReCODE protocol for reversal of cognitive decline. So now this study is looking at 100 patients, okay, treated by several different physicians across the world, across the United States. We go back up here through all of these. Actually, across the world, we have Sydney, Australia in there as well. And they looked at, again, documented improvement in cognition in some cases with documentation improvement in electrophysiology and imaging, whether that be like a PET scan, an MRI, or some other imaging that is looking at the brain matter and if there is any like decline in brain matter. So with the introduction, as I mentioned, Alzheimer's disease is now the leading cause or third leading cause of death in the United States. I think the first is heart disease and the second is cancer. There are many clinical trials of drug candidates or medications for Alzheimer's disease, but they're almost uniformly unsuccessful. And the reason why is because most Alzheimer's disease has a long pre-symptomatic period, meaning that the problem is happening in the brain, but or there's a certain cause or contributing factor that is not high enough to be causing symptoms, but it's just building. Then what is referred to as Alzheimer's disease is not really a single disease. So Alzheimer's disease is basically that there's this amyloid plaque that builds up within the brain. But there are many causes or contributing factors to that amyloid plaque. And so therefore it shouldn't really be considered a single disease, but rather there should be maybe subtypes that are the cause of it. Just as for other complex chronic illnesses like cardiovascular disease, there may be potential contributing factors to Alzheimer's, such as, and here are some of these, the inflammation, chronic pathogens, trophic withdrawal, so a lack of nutrients, insulin resistance, vascular compromise, trauma, and exposure to toxins. So therefore, personalized programs offer the best advantage. Okay, the next part of the introduction is kind of talking about that amyloid precursor protein that becomes cleaved, and then this forms plaque, and that plaque disrupts brain connectivity, synaptivity, and therefore brain plasticity. And so we'll just kind of skip through that. I want to talk about this part. So basically there is the probability of developing Alzheimer's disease is proportional to a ratio of synaptoclastic signaling to synaptoblastic signaling. So synaptoclastic means that synapses are being taken away. Synapses are what connects one neuron to the next, and they need to be connected and properly functioning for us and our brain to work efficiently. If we have more going away and more being made, then that is going to lead to more symptoms, because the brain isn't working efficiently to be able to take in what's around the environment, think, and produce an action, including memory. And so basically what we need to do is look for the contributing factors to synaptoclastic activity. And so this results in a personalized program. We need to include identifying and treating pathogens, such as Borrelia, like Lyme disease, Babesia, co-infection, herpes, identifying gastrointestinal hyperpermeability of the gut, repairing that gut and enhancing the microbiome, identifying insulin resistance and protein glycation, so basically blood sugar problems, and then returning the insulin sensitivity and reducing the protein glycation on blood cells, identifying and correcting suboptimal nutrient, hormone, and trophic support, including vascular support. So basically ensuring that people are eating the right nutrients, getting proper amount of nutrients to support their bodily functions, including hormone and growth of those synapses. And then lastly, identifying toxins. These could be like heavy metals, inorganic, organic toxins, other environmental exposures, and then reducing that exposure and detoxifying the body. Okay, so all these things could be resulting in this synaptoclastic activity, this breakdown of the brain, and preventing synaptoblastic activity. And so this article goes through a couple of patient studies that are more in detail, but then it kind of lists in a table 100 patients, 100 different patients, different ages too. So look at ages, I mean, the highest might be 85, lowest 50, right? So this is where Alzheimer's is multifactorial. It comes in many different ages. It could be due to genetics, or it could be due to environmental exposures at an earlier age, or poor diet, or whatever that may be. Most symptoms they're looking at are executive function or amnesia, like forgetting things. Diagnosis is either mild cognitive impairment or Alzheimer's disease, maybe subjective cognitive impairment. Evaluation, this is like the PET scan looking at the brain, MRI looking at the brain, CSF looking at specific antibodies that could be attacking the brain tissue. But then the functional studies were looking mostly at the MoCA, the Montreal Cognitive Assessment, or maybe the Mental Symptomatic Questionnaire. So the MoCA is a thing that is looking at, it's an assessment. It's assessing for cognition, and the score can be like 0 to 30, 30 being the highest, and is just a good cognitive assessment, kind of like the mini mental status exam, which could also be used, and I think some practitioners did. The Mental Symptomatic Questionnaire is, or subjective, mental subjective, I'm pretty sure it's questionnaire or symptom, is basically what the patient is saying about themselves. And so a really high number is bad, a low number means they don't have any symptoms. And so if we look through here, many people saw cognitive improvement that was assessed based on this MoCA. Some started worse and then still improved. Some started really well, like at 24, and got to 30. And the Mental Symptomatic Questionnaire was also much better in these patients as well. What's cool though is you can start this at any time in the progression, right? Now, like for instance, some people may start at 13 and go to 19. This is huge. This might be somebody who can't really, or doesn't know how to cook for themselves anymore, that now can cook for themselves and function. maybe a MOCA going from 0 to 5. This is somebody who can't function without anybody around them and are having accidents in their pants and need to wear diapers, to maybe somebody who knows when to say, I need to go to the bathroom, and can help get themselves to the bathroom. So there are many varieties in here. Some didn't improve as much as others, but that also can mean that there are other things going on, maybe specifically in the brain, where we need to have more mental stimulation or exercise to go along with it. Okay? So I just really like the study, kind of how it is a bunch of case studies, and it shows that there is need for a randomized controlled study or a randomized controlled clinical trial that is looking at basically what do we do for people that don't want to undergo any kind of treatment versus, or maybe medication treatment, versus a ReCODE protocol where we're identifying specific problems and fixing those problems and seeing what that can do to somebody's health and improve their dementia. So like I said before, I think this is a really important one. There are a lot of people that are afraid or scared of cognitive decline in themselves and their parents, and there is something that we can do, and that may include dietary changes, it may include lifestyle changes, it may include detox, it may include treating pathogens. The idea of just using a multifactorial approach to treat something that is multifactorial. And so again, please share this one. Please know that your friends, family, yourself can do things to reverse any cognitive subjective changes that may be going on with your life. And then at the end, besides doing that, there might be some brain stimulation that may be needed as well. And so we do have people on our staff at the Neurological Wellness Institute that knows the ReCODE protocol and do it well and treat patients, and have treated multiple patients with Alzheimer's disease or mild cognitive impairment. At the same time, we like to also stimulate their bodies as well, stimulate their brain, because once you create a proper environment, like dietary and lifestyle changes, then you also may need to activate the brain in specific areas to improve that cognition, executive functioning, and maybe the ability to hold bowel and bladder or some other factors. So again, please leave your comments, questions below. If you have any suggestions for future topics, I would love to hear them. Thanks again, and have a great day. Stay healthy.